Good afternoon. I am Carolina Vigna, Research Fellow at Beth Israel Deaconess in Boston. Thank you for allowing us to present our work in racial disparities in rectal cancer management. Are we providing equal care? We have no disclosures. Disparities in rectal cancer management exist, ranging from diagnosis to preoperative care, even to surgical management. And the vast majority of studies available assess white versus African American patients or combine races and ethnicities into a monolithic group. So we aim to evaluate short-term postoperative outcomes among different races and ethnicities in patients with rectal cancer following resection. For these, we use the ACS NetScript database along with the targeted proctectomy data file from 2016 to 2019 and included all patients who underwent with rectal cancer who underwent resection, meaning LAR or APR. All of those emergent procedures, patients with metastatic disease, unknown race or ethnicity, clinical stage, margin status were excluded from the analysis. We then proceeded to group the patients as following: non-Hispanic whites, blacks, Asians, and Hispanics. Primarily, we assessed the circumferential resection margin positivity rate, and secondarily, we evaluated surgical and 30-day postoperative outcomes. For this, we performed a 1-to-1 propensity score matching, using non-Hispanic white patients as controls while accounting for all known variables to impact surgical outcomes, including staging. We identified 1,753 patients, of which the majority were white, followed by Asian, Hispanic, and Black patients. On an adjusted analysis, we found that Hispanic patients had a statistically significantly higher rate of circumferential resection margin positivity with 13.9% when compared to 6% in white patients, 9% in Black patients, and 4.7% in Asian patients. Following propensity score matching, this remains statistically significant when compared to their white counterparts with a p-value of 0.032. Additionally, after adjusted analysis, we found that Black patients presented with longer operative times, increased postoperative ileus, longer length of stay, and Asian patients had longer operative times as well, more superficial surgical site incisions, and lower reoperation rates. Additionally, Hispanic patients had also longer operative times, fewer superficial and organ or space surgical site infections. So in conclusion, racial disparities were found in oncologic and short-term outcomes following surgical resection for rectal cancer. Specifically, Hispanic patients showed worse oncologic outcomes, and African American patients worse 30-day postoperative outcomes. So comparative studies evaluating trends over time, as well as higher number of minority patients in large databases is warranted in order to be able to identify patient, provider, and systemic factors influencing outcomes in minorities with rectal cancer. Thank you, and I'm happy to take any questions.